Welcome to Plastic Surgery T&A. Talk and advice with Dr. Earl Stephenson, board-certified plastic surgeon and facial aesthetic expert. Real talk, real results, real transformations. Let's dive in.
Hello everyone, welcome back to another episode of Plastic Surgery T&A, that's Talk and Advice. I am your host, Dr. Earl Stephenson, Jr., Atlanta Board Certified Plastic Surgeon, and today we're going to take a deep dive into a very small topic in size, but it's really big on its impact. Yes, we're going to talk today briefly about eyelid rejuvenation. Whether it's puffy lower eyelids, heavy upper eyelids, or you just feel like you look more tired than you feel, your eyes might be saying something your heart doesn't feel. So, today, let's explore how we can change that. So, stay tuned. If you're interested, here we go. Eyelid rejuvenation. Eyelid rejuvenation is very simply divided into surgical and non-surgical treatments. We're going to focus a lot on the surgical treatments. We'll touch a bit on the non-surgical, but in a broader term, it talks about the upper eyelid and removing excess skin surgically. Sometimes that's excess fat as well. In the lower eyelid, we're talking about removing excess skin and excess fat surgically, and then sometimes not just removal of excess fat, but also repositioning of that fat to obscure deep grooves, and one that's particularly troublesome called the tear trough or the nasal jugal groove. So we'll talk a little bit about that as well. So those are surgical methods in which you can rejuvenate the eyelid. Removal of excess skin of the upper eyelid and a bit of fat, maybe repositioning and contouring fat. In the lower eyelid, excess skin, removal of fat, sometimes contouring, and sometimes, and becoming more often, repositioning of fat to create a smooth transition from your cheeks to your eyelid. That's a very telling sign when you have this little line of demarcation. It tells that you're aged and nobody wants to feel or looked aged. And it gives you the appearance that you're tired, even though you feel fresh as a daisy. So, those are surgical ways to rejuvenate the eyelid. If you're not quite ready for that, you're not sure, you want to try or explore ideas not quite to that point, certainly there are a few non-surgical treatments that can help, but not dramatically improve as much as eyelid rejuvenation surgery. And those could be simply a little use of Botox. Botox is one of the most popular, if not still the most popular, non-surgical aesthetic procedure. Typically, Botox is given here along the outside of the eye or the eye socket to reduce those laugh lines or crow's feet, which can produce a nice effect when you're animated so it doesn't show the wrinkles that might give away some aging. Botox can be used a little bit underneath the brow and a little bit above the brow just to kind of give you a little kick in the tail of your eyebrows so that it lifts a little bit. And that can be a nice treatment, just small umph up of your brow just to make sure that it looks a little elevated. It takes a little stress off the skin of the upper eyelid and opens that up. And so, again, a nice little tidbit of a treatment to help you that's far short of surgery. You can also ramp that up a little bit. You can do some lower eyelid resurfacing with laser, typically CO2 is probably the best in my opinion. Some other plastic surgeons and facial plastic surgeons may use something different, but CO2 definitely will not only erase those wrinkles, but it'll do a little skin tightening as well, and it can make a world of difference. If you want to go a step in between Botox and laser, you can do a dermal filler or an injectable. I do this all the time. You can use products such as Juvederm or Restylane, which is made of a substance that's man-made that gives you kind of resiliency and kind of youth to your skin, a bit of plumpness. And what you do, and here's a little video excerpt of me treating one of my team members, uh, improving the junction between her cheek and her eyelid, that nasal jugal groove or that tear trough with some Juvederm. And just simply an in-office procedure. I do like comfort for my clients, so I will numb you up just like you've been to the dentist so that this is not a big deal for you. You can relax, listen to the music in the office, and get your rejuvenation stress free. So we just add Juvederm to this groove to try to smooth it out. We're not trying to build it up. We're not really trying to lift it. We're just trying to blur that distinction, blur that line so it gives you the appearance of fullness, plumpness, and that is equates to a more youthful appearance. So that's what we can do non-surgically. So that's eyelid rejuvenation in a sense. And we offer all those treatments here at ESJ Aesthetics, surgical and non surgical. So, with that information at hand, and now you're looking at yourself in your phone or on your phone or in the mirror at night or in the morning, you ask yourself, well, are you a good candidate? So, how can you tell if you're a good candidate? A lot of people think, oh, I'm old, I'm too old for this. And they really factor in age as a disqualifier. Age is nothing but a number. And in the words of Leah, God rest her soul, you could be 32 and have really, really heavy eyelids. Look at this example. This is a young lady. It's not terrible. Not saying that you need to rush her to surgery, but she's got some pretty full upper eyelids for her age. You should really be able to see a lot more of her upper eyelid. She may be considered, if she walks into your practice, walks into our practice, if she's a surgical candidate and she's young. So just because you're young doesn't mean you don't need it. And just because you're old doesn't mean you're disqualified from it. Again, it really depends on the genetics of your eyelids and the skin and the fat. Also, it depends obviously on your health. You could be an unhealthy 32-year-old who has diabetes that's not well controlled. You may smoke. You may have high cholesterol, and you can be a 58-year-old who is pristine as far as their health, no medical problems, or you have high blood pressure that you've been simply taking your medication since you were 30, and your blood pressure has been well controlled. So, again, age and health play a part, but not like you think. Genetics is definitely a component of it, and we marry all those things together to make sure that you're a good candidate. A couple other things to consider to see if you're a good candidate. You have to have, excuse me, realistic expectations. You can't come in and say, "I want my eyes to be refreshed, and I want my eyes to look like." This may be an old reference, and it'll give away my age. Eartha Kitt, the Catwoman, or Zoe Kravitz played the latest Catwoman. Cat eyes like that. You can't you can't have someone else's eyes. You can have your eyes, but refreshed. So you have to have realistic expectation. You have to have realistic expectations about the process. If you choose surgery, there is downtime, there's recovery time, there's bruising, there's a little bit of a maybe a mental step down because you're dealing with these things and you still have to deal with some of the things in life that you deal with every day. But we're here to walk you through every step of that. So you have to have realistic expectations about that. Obviously, there are financial realizations that you must kind of put into play. There's a chance of complications. We'll touch on that a bit later. You have to factor in that this oftentimes goes very well and people heal uneventfully, but there are times that things don't go quite so well, and you have to veer off course, and you have to kind of take some additional steps to get back on course, and that may cost you time, money, and of course effort. So you got to have expectations that are real about those possibilities. You got to be bothered enough about the changes around your eyes. You got to be bothered enough to kind of investigate. You got to do this for you. You can't do this for anybody else. You can't do this to get a job. You can't do this to secure whatever you're trying to secure. This is a self improvement, self wellness type of journey. And this has to be for you. So remember that good candidates are not excluded by age, young or old. You have to be in good health. You have to have realistic expectations, and you have to have great or the right motivation to do this. So now you know about non surgical and surgical and whether you're a good candidate or not, and you're probably working through that in your mind. What's best for you? Is it non surgical? Is it surgical? Again, if you want to go the non surgical route, there are some treatments that we can offer. You can have a CO2 laser. That's a laser that takes off the top layer skin. It penetrates just a little bit into the collagen and stimulates it and causes that area to kind of resurface. So you have kind of a do over. It can be done in the office. It can be done as an outpatient in an outpatient surgical facility coupled with other procedures. Maybe you do a facelift. Maybe you have some neck work. Maybe you had a little breast augmentation. You want to resurface your face and your eyelids. It can be done. And it's quite simply we resurface, pass the laser over that area once, maybe twice, and we allow the skin to regenerate a smoother, more youthful contour. You can have fillers like we talked about, and you saw earlier in the video. You can have fillers like Juvederm or Restylane. That can be done here in the office. It usually takes about, I'm gonna say, an hour in our office because we do make sure that comfort is paramount for you. I can't tell you how many times I've been with colleagues or been in other people's offices or had clients come from other plastic surgery or aesthetic surgery practices and they don't get numbed up because those practitioners don't know how to numb you up. This is why I am a facial rejuvenation expert. I have training not only in plastic surgery, I have training in maxillofacial surgery. So I understand anesthesia of the face. I understand the deep structures, the middle structures, and the superficial structures. So I use all my skills to make sure that you have the best experience possible. So we numb you up. So it'll take about an hour. Botox, if we're going to refreshen kind of the laugh lines, we're going to try to give you a little bit of a Botox brow lift, then that doesn't take very long at all. Typically, a little topical anesthetic on the skin. Our treatment takes probably about 15 minutes or so, and then it takes about 4 days for that Botox to kick in, and it usually lasts, and it depends, about 3 months. So those are things that you can do. So if you think that you're not that bad and you want to have a non-surgical route, those are things you can do. Come visit us, and we will make sure that you get the right treatment for your particular situation. If you want something that lasts a little longer, you feel that maybe your situation is a little bit beyond non-surgical, you want something that can be very powerful, then we're talking upper or lower blepharoplasty or eyelid lift or both. And coming into our office, meeting with me for at least an hour, talking about you, who you are as a person, what you do, what you like, what your goals are. What do you think that you want to improve? What are you willing to, what journey are you willing to take? Going over the risk and complications. We come up with a plan for you. Getting that all done, presenting the financial end of it to you so that you can make decisions, talk to your inner circle to see if this is something that seems right from their end, but ultimately you make the decision. We give you all that information so that when you walk out of your consultation, you're armed to make the best decision for you, whether that's to have surgery, have non surgical procedures, not to have any surgery or non surgical procedures at all, or not to have them with me. I give you the information. We're not here to chase you down, bend your arm. We want to make sure that, we understand where you're going. You may tell us, no, it's not for you. We won't bother you. You may tell us, yes, we want to move forward, but not at this time. Again, you get my point. We make sure that you're fully armed and educated when you leave the office. So you decided that you want to have something done. And let's say you decide you want to go with a surgical procedure. The procedure takes, depending on what you're having done, anywhere from an hour and a half to about, in my hands, 3 hours. The upper eyelids, let me back up. I believe I talked to a lot of surgeons, plastic surgeons, facial plastic surgeons, excuse me, even oral and maxillofacial surgeons. And some people are very flippant. And what I mean by that, they just, it's just eyelid surgery. Eyelid surgery is a very elegant surgery. It's some very critical structures in the area. You have to understand the anatomy. It's not just about pinching off extra skin and sewing it up. It's not that. You have to be respectful of the anatomy and function of the eyelids. So I take that in prime consideration. So again, if you're going to have an upper eyelid surgery with me, whether it's in the surgery center in conjunction with something else, it's a standalone upper eyelid surgery because you want to be completely comfortable, asleep, and relaxed. Then we'll do it at the surgery center. If you want to do it in my office under a little oral sedation where you're very relaxed, a lot of times our patients fall asleep and we can do that in the office. Again, takes at least about an hour and a half. If you want to do the lower eyelids, it may take me about 2 hours and some change because we want to make sure that we remove the excess skin. We want to make sure that we contour or remove the fat that bulges or reposition it. And we want to make sure to be respectful of the lower eyelid. And what I mean by that is we want to make sure that we tighten the lower eyelid and maybe sometimes even over tighten it so that you have the eyelid that is touching the globe and not pulled away. This is I wouldn't say a tough complication, but it's very stubborn to improve. It is something that you don't want to see as an aesthetic facial surgeon, aesthetic plastic surgeon, as an outcome, either initially or 6 months down the road, most certainly. So I take my time to make sure that anatomy is restored. And sometimes it requires some fairly complex maneuvers in a tight space to get that done. So it may take me 2.5 hours. Excuse me, I'm so sorry. 2.5 hours. If you do those upper and lower eyelids together, it may take me 3 hours. So I'm really respectful of that area to make sure that you get the result you want. You still have the function that you need. So again, it's a very powerful procedure. It's a long lasting procedure. If you feel that you're ready and I feel that you are a candidate, recovery from something like that is not back at work in 2 days, depending on what you're doing. Most clients take off about 5 to 7 days from work. Yes, there's going to be swelling. Of course, there's going to be bruising. But in my practice, I like to get out in front of that. offer or we couple treatment of arnica, montana, and bromelain prior to surgery and after surgery to minimize, not eliminate, but to minimize bruising, which makes you feel better psychologically, which tends to make your recovery go much smoother. There will be some discomfort. Usually it takes about a day or two. Most clients are probably off of their or have significantly decreased their narcotic pain medicine at day 3 to 4, if not sooner. You can usually apply makeup in the form of concealer at about 10 days to 14. And it takes about 4 to 5 weeks for a lot of the swelling to go down. There will be some rebound swelling where you're puffy in the morning, less puffy in the evening. You'll go back and forth with that for a couple of weeks until you reached about the 3 month milestone. So there is a process for recovery. You got to factor that in. You've got to be ready for that. But it is so, so powerful on the other end of that. And you'll be ecstatic, thrilled with your result. And people will notice, they'll ask, they'll look, they don't know quite what to make of it or of you. And you can play it off however you want to, but people will notice. So that's the recovery rundown. So, with that being said, I know that your interest may be peaking. You might want to have a conversation. We're here for consultation. I'll give you that information, but you can always jump on my website at www.esjaesthetics.com and kind of look at our webpage concerning blepharoplasty. Here's the web address here. And you can start to do a little research even while I'm talking, and definitely long after I'm done. So, certainly a good start. A big question I get from clients, potential clients, is I still want to look like me. And we still want you to look like you. I made a reference to this earlier in the podcast. I can't make you look like anybody else. I can't make you look like the person you admire in your circle or the person that's a celebrity or your aunt or your mom. I can make you a better, more refreshed version of you. And that's all I can do. Some people may promise you the moon and the stars, something different. I can't speak for them, but this is what I can do. So, yes, you'll look like you. You'll not look windblown. You'll not look done, so to speak. Surgical artistry matters. Before I was a plastic surgeon, when I was 18, trying to figure out what I want to do in life, I wanted to be a commercial artist, kind of like I'm watching Mad Men. I've never watched it before. So it's about the advertising agency, and they have artists that do the renderings for their ads. That's what I wanted to be. I wanted to be the artist. So lo and behold, my mom's like, no, you need to get a job so you can eat. And so, long story short, I'm an artist, and artistry certainly in aesthetic plastic surgery matters. So, again, my training in maxillofacial and plastic surgery helps me have a tremendous understanding versus some of my peers that may not have the training that I possess, and I'm fortunate for that. So, we're enhancing, we're not changing, we're enhancing your look. And so, to that end, here are a few examples of how we can enhance your look. Here is a before and after of a client who basically needs upper and lower blepharoplasty. This is on my website, and you've probably seen this around. I like this before and after because it's really powerful, and I think it's a great illustration. It's easy to follow. Upper eyelids are really saggy. On the screen, it would be our left upper eyelid. It seems to cover the eyelashes. The right one not so bad, but as you can see, she had an upper eyelid blepharoplasty, and you can see more of the upper eyelid. She looks younger. Now, her lower eyelids are giving her away a bit because they were not treated. She did not was not ready for that. But her upper eyelids definitely give her a significant transformation. It makes her look refreshed. It makes her look younger. It makes her feel better. And if she's a makeup kind of gal, then she can easily apply her lash liner. She can easily apply her mascara her lids. So it just makes life easier and makes her happier. So again, powerful, big operation or big results in a small area. Here's another before and after to show you that you will look like you. This is lower eyelids. Her upper eyelids are okay. Not bad. I mean, somebody could challenge me. There's a little upper eye excess skin. Maybe you need to treat that. Maybe you didn't. But in real time, I didn't think it was a something that would move the needle greatly. And she was really concerned about the puffiness in her lower eyelids. As you can see, it really made her feel tired. She became very self-conscious about people making comments about her state of restfulness. And so she was interested in a lower blepharoplasty. Now, there are various ways to do that, and that this podcast is not going to talk about the approaches to the lower eyelid, but there are basically two. You can go on the outside and make an incision kind of just under the eyelashes, or you can go on the inner part of the eye, in the red part of the eye, and make no incisions on the skin at all. So therefore, there are no healed incisions. So this is what we decided to do. She's a lady of color, and so we wanted to make sure that her concerns about pigmentation, scarring, potential keloiding, which is very rare in the eyelid area for people of color anyway. And I've done a lot of these approaches for cosmetic and for reconstructive surgery in the past and really not had any problem whatsoever with excessive scarring in the form of keloids. But nonetheless, she was concerned about that. And I didn't think that she had a ton of excess skin. I felt that if I could get to the fat pads that are bulging, that her skin would just follow suit. And, based on my experience, that's exactly what happened. So we decided to do a transconjunctival blepharoplasty. Now, that's a fancy word to say that I went on the inside of the eye, the red part of the eye. She was completely asleep in the operating room, got to the fat pads, removed, contoured. I didn't reposition. And then just put a couple of dissolvable stitches in that incision line on the inner part of the eye and let nature take its course. And you can see again, small area, powerful, big result. Definitely looks more refreshed. Definitely looks younger. She's definitely happier. So again, eyelid rejuvenation surgery can be very impactful. So if you've done every makeup trick, you've done every micro needling thing, you take good care of your skin and you still have, father time just kind of that much ahead of you, we can backtrack you a little bit. We can't stop father time from marching forward, but we can take you back. So, upper eyelid surgery may be something that you can, should consider, and you will be a better version of you, not someone else. So this all sounds great. It's gravy. Oh, this is perfect. We don't live in a perfect world. Things happen. There are risks, red flags. You got to choose the right surgeon. So there are complications with surgery, no matter who you choose. And then you have to, on the front end, choose the right surgeon for your particular situation. So here are a couple of risks, and let's be honest, there's a couple of risks. The first risk is dry eye. You will probably have some dry eye initially because you're swollen. The lids will be a little bit out of position, and it'll expose your eye a bit. So you'll have a little bit of dry eye. I recognize that. We in your medications to take or use after surgery, we also recommend an ointment that soothes and protects the eye. At times, initially for the first couple of days, I may actually put a couple stitches in the corner of the eye that we remove very comfortably in the office to kind of decrease the exposure of the eyelid due to the exposure of the eyeball or after surgery. So there are things to do to reduce that. If you have a history of dry eye before, that's important to know, and that's an important historical fact to get during your consultation. And then there are decisions to be made of how to manage that if we decide to move forward, or if we need to move forward at all. So that's a potential complication, dry eye. It's usually temporary just due to swelling and improves if you do not have a previous history of dry eye disease. You can have asymmetries in the outcome. And I think that boils down to, in my opinion and experience, a couple things. Not recognizing how well, especially in the upper eyelid, that's really where I'm kind of going with this. Well, the upper eyelid closes and opens, and that's an independent muscle. And you got to make sure that that muscle is functioning well. And you recognize that. You got to make sure that during surgery, you don't injure that muscle so that you end up with an eyelid that's kind of droopy. If you've done all those things and those that eyelid muscle is working well, you didn't injure the eyelid muscle during surgery, but you did not plan your surgery well, where you have an incision that's higher than the other, then you can have problems. And this is an example of any of those little scenarios that I talked about. It can produce this. As you can see, the arrow shows you one eyelid crease that seems pretty natural on our left, and another eyelid crease that seems totally unnatural. That's high on our right. Now that could be due to a poor planning from planning an incision line that's different heights, or it could be due to injury of that muscle that raises your eyebrow. Excuse me, raises your eyelid, upper eyelid, or it could be due to unrecognized decreased function of that same muscle prior to surgery. Any how or any way, you've got a problem. And you've got to know that this is a potential problem and it needs to be corrected. And the right diagnosis, as far as why this is happening, needs to be obtained so that the right surgery procedures can be performed. In this case, an ounce of prevention is worth a pound of cure. You make sure that, and I know that I do, painstakingly go over the marks before I make any incisions. You know, measure twice, cut once is the old axiom. I sometimes measure four times before I cut because once you do it, it's done. So again, experience counts. So definitely you can have these asymmetry to your result. And so choosing the right surgeon who has experience with eyelid rejuvenation is crucial and knows how to manage complications. There are a lot of surgeons who do things that don't know how to manage the complications. And that's why I think the plastic surgery portion of my training is so valuable. Before I could do any of this as a trainee, I had to learn how to reconstruct, rebuild, give function to eyelids that were torn off before trauma, eaten up by cancer, you know, thoughtfully removed for precancerous or small cancerous lesions or what have you, and rebuild these so they look aesthetically good and they function well. So, again, that's why plastic surgery training is important, not cosmetic surgery training, which is totally different. Just knowing how to improve something, but not knowing how to functionally take care of the area if there's a complication or a problem. Last potential complication, which is the one that I try to definitely avoid as much as I can and be proactive, is called ectropion. It's an outward pulling or downward pulling of the lower eyelid. And really, again, an ounce of prevention is worth the pound of cure. In the consultation, I'm pulling on the eyelid to see how quickly it snaps back. I'm looking at the skin, kind of what I call resiliency. Look at mine, I'm old. You see how it still stays tinted up. I'm feeling the laxity. So that tells me my eyelid may be a little loose. I will make an incision either on the outside or inside, and that swelling will pull down on that eyelid, and sometimes it scars that way. So I want to prevent that. Or I want to say that this eyelid is so loose that if I just don't do anything to tighten it, that's a diagnosis. It's got a lax eyelid, then I'm going to end up here. So what I do is I go through all those maneuvers at your consultation. I make notes and I make that part of my plan. How am I going to manage the lower eyelid so that it's tight? It's a little over tightened so that at the end of the healing journey, it's right where it needs to be. It's just at the bottom of your colored part of your eye. It's got the small triangle, slightly larger triangle, and it doesn't look like this, which gives you a bigger triangle of white eyeball toward the ear, which often leads to tearing. You're like, oh, my eyes are so watered, they're irritated. That's because the exposure of your eyeball, because of the poor position of your eyelid, is causing the tearing. It's reactive. And this looks unesthetic. If I had eyelid surgery and this was my eye that was repaired and looks great, and this is my other eye, that's not aesthetic. So I tighten the eyelid, and there are various ways to do that. And it's technically challenging, but you have to do it. You just can't go off and pinch skin out, take out a little fat, and not appreciate what the anatomy is, what the function is, and anticipate for for potential problems such as ectropion. So let me give you an example of that. Here's a gentleman who saw all kinds of people many years ago. I was early in my practice. Even saw some eye doctors and saying, "Look, they've done this, and this, and nothing's worked." You can see on our left that the eyelid is way retracted. Now, can be due to many things. It could be just because this eyelid was loose and it's pulled down by scar. Maybe when somebody did his lower eyelid surgery, they took off too much skin. Maybe they injured a little uh, muscle here called the lower lid retractors. There are all kinds of things that can happen. But nonetheless, on his left side of the screen, that eye is really exposed. On the right side, it's a little exposed, but still not where it needs to be. And this needs to be corrected. You can always already see on the left side, he's got some blood vessels that are kind of creeping in. It's because it's irritated. It's being dried out and he's tearing, and it makes his life miserable. So if somebody comes into my office and they want aesthetic rejuvenation, this is not the result I want at the end. This is more of a problem. So I try to combat that at the front end. So this is what I did for this young man before and after. Is it a home run? No, it's not a home run. Is it much better? It absolutely is much better. Is he tearing? No. Is his eye dry? No. Is his life miserable? Not anymore, at least not from his eyelids. So, I repositioned, tightened the eyelid. I thought he had enough skin. I didn't think it was scarred down because of the muscles that I mentioned before. So we just released the lower eyelid and kind of resuspended it higher and tacked it up to its rightful position against the eyeball and the corner within the eye socket itself. Again, you got to know the anatomy. And this was an improved result. So again, complications happen. Dry eye, asymmetry, ectropion or pulling of the lower eyelid, picking the right surgeon, a board certified plastic surgeon, board certified facial plastic surgeon who has extensive experience in facial rejuvenation is going to be key. Doesn't mean they won't have complications. It means that they know how to know how to recognize complications and treat them, and know how to prevent complications as best they can with an ounce of prevention. Again, is worth a pound of cure. So we've gone through all that. Of course, people are like all excited. Well, how much does it cost? Usually, upper eyelid surgery and lower eyelid surgery can have various ranges due to geographic variation, the doctor's experience, so on and so forth. In general, in my practice, these procedures run around anywhere from 3,500 to $9,000, and that's just not my fee. That's including everything: anesthesia, facility, so on and so forth. But it also depends on the complexity, whether we're doing upper or lower or both. So we add all those things together and we come up with a proposal or a quote for you. Our quotes are itemized so that you know that you're paying for. And it's, again, no pressure. We just present that to you so that you can have the discussions you need with yourself, your trusted loved ones, about whether you want to make this investment in yourself. Again, no pressure. Just, talk to your peers, yourself, about, am I ready for this investment? So that's our cost range, 3,500 to 9,000. Every case is different. We don't rubber stamp it. We build solutions to your concerns, and those solutions have different price points. Lastly, when people talk to me about eyelid rejuvenation, they probably think, well, this is just for Caucasian people or white people. Well, I do this for African American people. I do this for Latino people. I do this for Asian American people. So you have to be culturally and culturally sensitive, and ec- and ethical, not ethical, ethnic. What am I trying to say? Ethnic. I'm struggling. Cultural sensitivity. How about that? And ethnic sensitivity. Tongue twister. So, for my Asian patients, a lot of them come in with a crease that's not really developed or seen. They don't really, you can't really appreciate it. And so a lot of them want a Western eye, for lack of a better term. And we have a technique that's not proprietary. It's, a standard technique in facial plastic surgery in general, or where we create a defined crease, and that makes them happy. So, again, we're culturally sensitive to patients' concerns and desires. As you can see here, I'm marking that crease on this patient. So we take that in consideration. As I mentioned before, we're culturally sensitive for our African American community and our Latino community and people of a little deeper color, about pigmentation and heel incisions, keloid formation and heel incisions. So we have methods to minimize that, treat that if it occurs. But again, the eyelid skin is so resilient. These issues with problems with healed incisions, it's almost non-existent. This heals very well in all comers. So again, there are many factors. We factor in your desire to have it. You have to talk about whether you're willing to invest your time, money, and effort. You have to think about all the things that need to be factored in for you to make this big move to invest in yourself. We factor in things that we can point to: your age, your health, your motivation from our end, your um, cultural and ethnic upbringing, all factors in how we design your plan for your rejuvenation. So, if this rings to you, something you've been thinking about, but really never had a discussion with anybody who's an expert or professional, I encourage you to take the step. The first step is the easiest step, and we make it easier by just having you call the office. Here's the number: 770-466-4700. If you're not sure you want to kind of just get on live and do that, you want to send us an email. You can email us at concierge at ESJ Aesthetics. We'd be happy to answer any questions. Whenever you're ready to make a consultation, you can request one through email, or you can call, which is the easiest, and my team will be here to assist you. Our consultation fee is $225, and we spend at least a minimum of 1 hour with you. So we give you value for your time. And we're here to answer all your questions because, again, we want to arm you with information so that you can make the best decision for you. With that being said, I hope this video has been helpful. I hope you enjoyed the podcast. If you do, please share. Give it to someone who may not know this is happening, that they can get information, advice without stepping into a doctor's office and paying money. They can do with that information what they will, but all of us at some point have something that we don't like about ourselves physically, whether we're motivated enough to do anything about it or care enough about it that it affects our daily lives. That's a different story. But there are people who do consider this and may want to know more. So share that. And if they share it, please like it. Please like it if you get it and receive it. And you like this video, you like other videos on my channel. Please like and subscribe. It really helps my channel become more visible on social media platforms. If you're already watching this, thank you so much. I really appreciate your support. Continue to follow us. Again, likewise, the more times we have people view, the more the algorithms pick us up and determine that we are somebody of relevance, and they will show our videos because I'm out to give truth as well as transformation. And on that note, we'll see you next Saturday. I hope you guys have a wonderful weekend, and I hope you're healthy, happy, wherever you are in the world. Until next time, peace.
Thanks for tuning in to Plastic Surgery T&A with Dr. Earl Stephenson. Got questions about eyelid rejuvenation or ready to take the next step? Visit esjaesthetics.com to schedule your consultation. And don't forget, your transformation starts with education. Until next time, keep shining.